We're going to talk about IC Medical today. I'm Jeff, this is Paul. The machine's already on. There's two filters that you need to be aware of. First of all, there's one on the back, okay? That is this charcoal filter, okay? This just screws in to the machine itself, and there's an installation date on here. So I like to write an expiration date instead, so we know when we need to replace it. So these are good for 90 days. And so if we were to do it today, it would be 319, so let's just put a switch on 619 written on here, okay? Then it just screws into the...
90 days. Why do you do it 3 months? 90 days is crazy. No,
3 months.
Easy. 3 months, you mean really means 3 months, yeah.
Okay.
Could be 92 days.
The other filter with this machine is our OPA filter and fluid trap, which goes on the front of the machine. Okay? It just simply clicks in with an audible click. There's a button right here for release, to release this and remove it. Okay? These are good for 6 to 10 cases. But before you get to 6 to 10 cases, there's probably a good chance that there will be some blood and tissue sucked into this filter, and you want to throw it away as soon as there's evidence of blood or tissue in the filter.
Okay, then delete it, or can use after
6 to 10 cases.
6 to 10 cases, okay.
So if you're doing cases and you're not seeing blood or tissue in this trap, then maybe you make a policy where you switch it once a week. You know, on Mondays you just come and throw out all the old filters and replace them. So that seems to be pretty simple and straightforward. Now let's talk about the pencil itself, okay? So out of the package, this is our smoke pencil that plugs into this smoke evacuator. If you've worked in the main OR, you've already seen this pencil, okay? It's the exact same one that they use now, okay? There's two plugs. There's a tubing that lure locks into our ultra filter of the machine, and then the other plug is for your bogey, okay? And it just plugs in just like every other bogey pencil plugs into any unit that is out there, okay? So now we need the smoke evacuator and the bogey itself to communicate. So that's how we do that is with this RF sensor. So I take, there's already Velcro on it, okay? But that's just for safekeeping so it doesn't fall on the floor, okay? The other Velcro I'm going to take with the bogey cord and then adhere it to this other Velcro so it stays put, okay? Now, whenever the surgeon keys this bogey, there's electrical leakage that's coming out of that wire. The sensor senses it and turns on our smoke evacuator, okay? And it continues to run for as long as you are keying the button. When you take your finger off, this time setting determines how much longer it continues to suction. So I was doing it 2 seconds, which is the lowest one we have. Usually when the surgeon stops cauterizing, they're on to something else. And they're not standing there holding it, trying to get any residual suction. So in an effort to be more efficient and less noise pollution, let's leave it at 2 seconds. I also have the setting at 65. The machine itself goes all the way up to 95. But we are still completely efficient in suctioning smoke at this level and not making our machine too loud, okay?
Yeah.
The only reason I would turn it up to 95 is if you were doing a case like a condyloma or genital warts or something like that, and you really want suction to be at full strength. But if we have it at 95 throughout every other portion and every other case, you'll end up suctioning some tissue, which I'm sure you guys are familiar with or have seen or heard, and then it'll occlude and the machine will beep and eventually you need to clean it out somehow. But if we keep it at 65, we generally avoid getting a bunch of tissue sucked into the pencil. And so that's what I do with that. This is what I've asked, and this is what actual is. Liters per minute is what we're talking about and looking for that. The pencil itself is universal. So if you like to use a guarded tip or a needle tip, then just take our cautery tip that it comes preloaded with and put your guarded tip in, okay? Any of them will fit that you already have on the shelf now, so there's nothing fancy about this. This pencil also has the ability to telescope, okay? So I always say just do a quarter turn and then put it to wherever you want and then lock it back in place and now we're stuck there, okay? If we unscrew this all the way, the whole thing comes out, no big deal, only goes back in the exact same way it came out. But if we stick to that, do a quarter turn and then put it to where you want, tighten it, now we're locked in place. once in a while, we will hear that it's difficult for a surgeon to have visual looking down this Bovie pencil and seeing the cautery tip, okay? Usually only happens in a pocket, so like a total hip or like a breast case or something like that, where you're actually using the telescoping part, but it's difficult to see the tip. So for that scenario, I would just take a 4-inch cautery tip that you probably already have on the shelf, because most have these, the 4-inch and the 6.5-inch, okay? But if you put a 4-inch in, now I'm just kind of mimicking where it would be sitting. And so now I have visualization, but you're in a pocket, so it's still going to suction all the smoke out. So now that's how we accomplish that one concern or rejection. I think that's pretty much it. So are there questions about any of this stuff?
Let me stop before.